Dr Marcia Braden is well known to us here in New Zealand and Australia, and we're very fortunate to have the opportunity to ask questions of someone incredibly knowledgeable about Fragile X syndrome. I don't think there's anyone more experienced or knowledgeable than Marcia, who has spent over 30 years working alongside individuals with Fragile X and their families, and is recognised internationally for her expertise. So I'd like to now hand over to Marcia to introduce herself to those who may not have had the pleasure yet.
Thank you, Andrea. Welcome, everyone. I think this is such a fun opportunity for us to connect in a way that is pretty casual, informal, and I love the format of asking me questions. So just to let you know slightly a bit about myself, and I do know you probably already know this, but I am a clinical psychologist in Colorado Springs, Colorado in the US. And I started out as a teacher and then worked my way to a PhD in psychology and educational psychology as well. I've seen many people, children starting out, and then now they're all adults, or many of them are adults. And so I've been able to look at that trajectory through their life and notice the changes and things that they are capable of doing as adults that maybe we doubted when they were younger. So it's been a wonderful journey, just blessed me tremendously, and I appreciate all of your support and trust in me. So I really want to start with some background, because I think before we answer these questions, it's really important for you to have this basis. And remember, we'll put up a slide later about the YouTube videos that you could go to if you need more reference. But right now, I just want to lay the foundation slightly. I think it's going to help with an understanding of how I answer your questions about behavior, because we sort of focus on the behavior and that we don't really look at the whys and what's going on as a result or even prior to the behavior. So we want to talk about the science for a little bit and this gene. This gene has a pretty big impact on the brain and on the development of the brain. And if you look at this first slide, you're going to see a normal X chromosome, and then you're going to look at the fragile X chromosome, and you're going to see that little fragile site at the bottom. And that's really what we're talking about today, because it does affect behavior in all kinds of ways. So let's see why that X is fragile. It's because of this protein, and this protein is called the Fragile X protein. It plays a role in pre- and postnatal brain development. It's really important for that learning and cognition, and it really regulates lots of genes, and that's something that's been pretty exciting because we've been able to help the autism community as well, and looking at proteins that may in fact be affecting them. So again, it really looks at that protein and why that absence of protein affects these synapses and lots of things about these neurons. It can't be, it's very important. And so we have to really include it in our discussion, because without the protein, many of our individuals are developing in ways that we have to sort of structure the environment to help them get through some of these difficult experiences. So looking at how this really looks in the brain, the lack of that protein causes some overabundance in brain connections. And I want you to look carefully. This has been studied thoroughly. We're very happy to be able to share this information because it's not something that we think any longer. We really have the studies to support it. And so there are these areas that are most affected by the lack of the FMRP. And again, it's important to know this because those areas affect our behavior. So we have the cortex in the back, we have the hippocampus, the amygdala, and the frontal lobe. And those are the areas that I want to talk about most because, in fact, that does affect cognition and behavior. So what about this? I mean, why exactly does this improper brain connection affect these individuals with Fragile X, and sort of how? So we look at the strengthened amygdala, and remember that was the area there that was kind of in the front. And we know that the extra strengthened improper connection, the overabundance, causes great anxiety. And this is probably one of the most important things that we will journey with today. It is really important for us to understand how much these children live with anxiety. And in this group right now, we're going to talk about the younger kids, but it goes on through the lifespan. The anxiety is there all the time, and they are constantly fighting it. And also, there's a weakened area in the cortex and hippocampus, which affects short-term memory and attentional control. And so what I really want you to try to do is expand your thinking about behavior and think about how anxiety might affect behavior, how lack of attention and memory might affect behavior, and then this next weakened frontal lobe area, which affects the hyperactivity and executive function. And what we mean by this is the ability to kind of formulate a plan and execute it. So oftentimes when we're giving them behavioral scenarios or we're giving them consequences, you'll do this and then you'll get this, they may have trouble really understanding and executing a plan to take care of that behavior. So again, this is all neurobiology. We're not saying the kids are manipulating us in any way. It's hardwiring. And I really want you to take that into consideration when you are looking at the behaviors of your children. So if we look at Fragile X syndrome, there are some strengths and there are some challenges. And again, we're going to expand this all so that you can sort of wrap your heads around, oh, that may be why he's biting himself, or that may be why he's having trouble settling at night. They are strong visual learners. They have wonderful memories. And those of you that have these children know that they surprise us, don't they, oftentimes, because they can remember things from the past. They remember things they've seen. They are wonderful individuals. They have wonderful empathy. And really, when we look at this population as compared to maybe those that have other issues going on, they're the ones that really feel the emotion. They know that from our faces and the way we're responding, that oftentimes we're upset. They understand that, and they have great emotional empathy when they've hurt us, for example, or thrown something at us. They feel terrible about it. They have that empathy. They want to be helpful. They're such good helpers. And the more we can give them to do and feel good about themselves, the better the behavior. Wonderful sense of humor. Aren't they funny sometimes? And that kind of gets us into some things sometimes with them, because they may do something that's sort of naughty, but it's so funny that we might giggle about it or laugh about it. And what we've done then is reinforce that behavior that we really want to get rid of. So again, we have to sort of be careful about that, but they really engage us in some wonderful humor. They love being social. They love being with their families. They have approach avoidance sometimes with that love of being social. Sometimes it seems like they would like something, and then it turns out when it's time to go, they sort of back off. And it's a developmental disability. And by this, the lifelong learners, I just mean that because it's developmental, it continues to grow in a positive way. So they're always learning. They just may not be at the same level as their neurotypical peers. But they also have challenges, and their challenges sort of, cause us some frustration sometimes, because we really don't understand why they can't understand certain things. They have some intellectual disability and some developmental delays. And of course, that can also mean that they have motor problems and they have problems with speech and language in that developmental delay. They also, as we said earlier, have a great amount of anxiety. And again, we'll bring that into play when we talk about the different behaviors, because fighting that anxiety is something that really uses up a lot of their energy, and they're always trying to make themselves feel less anxious. They do have some health issues that we have to contend with. Sometimes those are things like mitral valve prolapse. It might be something with flat feet. It might be occlusion in their mouth. Those are things that are their health issues. And then attentional problems. Again, a lot of times we have a diagnosis of attention deficit disorder with these individuals. As I said earlier, the communication, sensory, and that's all part of that developmental delay. And then a lot of behaviors that are associated with Fragile X and also autism. And so some of you will be thinking, while we're talking about behaviors, well, my son has a diagnosis of autism spectrum disorder. And that's very common. We need to remember the distinction between a diagnosis of Fragile X syndrome, which is a genetic condition that we can find in the DNA. So again, that's hardwiring. And then autism spectrum disorder, which is just a series of behaviors on a checklist that describe those with autism. So again, you can meet that criteria if you meet enough of the criteria in the checklist for autism spectrum and still have in the DNA the Fragile X syndrome. So again, that isn't anything that's mutually exclusive. Some individuals with Fragile X meet that criteria, some do not. So if we don't think about this biology and anxiety, and we sort of just roll on and think, well, this child should be able to do X, Y, and Z, and he's not learning these rules and he's not responding to my intervention. This is what kind of happens. And we've learned this from people who are older that can tell us what it feels like and what they do to deal with their anxiety. And some of it's pretty maladaptive. But again, you can sort of put yourself in their position. And when I'm anxious, I'm pretty cranky. I'm pretty irritable. And I think we need to understand that's sort of an overarching behavior that's a result of this anxiety. Sometimes they lie, and that's because they know they're in trouble and they're anxious and they want to get out of that anxious situation. And so they might tell a little fib about what's going on. They might not be very truthful. They may be aggressive and then sometimes self-abuse. So either it's outward or inward because they're trying to ameliorate the anxiety. And it's very difficult. They avoid because if they don't, when they're anxious and something they know is going to cause them to be even more anxious, very good strategy to avoid, right? You sort of preserve the organism. You preserve yourself because you're going to avoid something that is scary or something that causes you to act out, like a loud environment or noises. You become obsessed sometimes, and people with anxiety try to sort of fix their anxiety by becoming more obsessive. And that means that they have routines or they have things that they want to do in a certain order, and they kind of get stuck on that because it really helps them feel secure and less anxious. And those of you that may have dealt with anxiety disorders before know that a lot of times one of the underpinnings is to be obsessive compulsive. And so you put everything away or you clean your house, and that makes you feel a lot less anxious. Sometimes they pick at things, they pick at scabs, they pick at their skin. That's sort of a byproduct of their anxiety. And then a lot of times the girls have told me that they laugh at inappropriate times, and the boys can too when they're young, that they think something is sort of funny or it's been reinforced as being funny, and so they do it more during that behavioral episode. So again, just thinking about these things before we start answering questions about behavior, it's really important for you to think about all of these sorts of behaviors that are a result of the anxiety that they come with, and that they're trying to sort of take care of their anxiety using these behaviors. So, people often say to me, okay, we've got all these issues going on. What should we deal with first? Well, it's pretty hard to sort this out because when a person with Fragile X syndrome becomes hyperaroused, which is basically the byproduct of anxiety, they really sort of get hyper over the top. They just can't settle themselves down. And so here's some things that happen as a result of that hyperarousal. And it's really a hallmark of those individuals with Fragile X. They have behavioral issues. The environment may be causing them to become more hyperaroused. The sensory input could also cause that to happen. They don't understand and they can't really communicate well. So again, the linguistic deficits get in the way and really contribute to the hyperarousal. The curriculum, the expectations, the things that people are asking them to do. And this is something that happens in schools oftentimes, that we're asking them to do things that are really difficult for them. And they're individuals who don't want to disappoint. It's really interesting. They want to try to please, don't they? They want to be the helper. They want to be the good guy. And so they try really hard to live out that expectation, but oftentimes it causes them to become hyperaroused because they can't tell you I can't do this. I don't want to disappoint you, but this is too hard. Or I don't understand what you want me to do. And then social expectations. Go say hi to so and so. Go talk to grandma on the phone. Go over there and do something with those kids. That all contributes to their hyperarousal because it's very difficult for them to do that, even though they are social beings and they love being in social situations. When they have to execute the social interaction, it is very difficult and it really contributes to hyperarousal. So again, even any part of this would contribute to that hyperarousal, and that causes some of these behaviors to escalate. So I always like to look at this before we start to sort of, I like to say, do autopsies on behaviors and try to pick them apart and figure out what's causing what's going on, because that's the only way we're going to resolve it, right? We can't just focus on the behavior. Okay, the behavior is aberrant. We don't like it. That doesn't do us any good. We've got to figure out, okay, why is that happening? And then what are we going to do to change it? What are we going to do to support that child to change that behavior? And so here's some of the neurobiological underpinnings in the big circle here. You remember we talked about these, the anxiety, the language problems, the sensory, not understanding something that's coming to them through their ears, through their eyes, through their touch, through their skin, and then their cognitive delays. So those are kind of the major neurobiological underpinnings. Well, then they have to do something about that. If we ask them to do something and they're very, very anxious and they don't know how to reconcile that, they're going to do some things to let us know I'm anxious. But they won't just say to you, Mommy, I'm really anxious today and I can't do that. They're going to do things like run away. They're going to throw things. They're going to destroy property. They may hit themselves or bite themselves. They might yell at you. They may curse. Those are the things that they will do as a result of this neurobiological status. And so when you ask them to tell you something, when you ask them to do something that's out of their comfort zone in terms of their anxiety, when you ask them to be in a noisy environment and the sensory input is just too much for them, or you're asking them to do something that they don't understand, they don't have the cognition to understand, they do other things instead to tell you, I can't do that. And so what do? We respond, don't we? We respond to that running away, that throwing, that destroying. And what happens with that is it pretty much cements the cycle. In other words, here's where the underpinnings are. Here's what the child does to tell you, I can't do that right now. And then you respond a certain way. That's the cycle. And what we often have to do is to interrupt that cycle. We have to do something different in that process. Otherwise, we run through the same scenario over and over again. And I'm sure those of you who are listening right now are nodding your head and saying, yep, that's exactly what happens. So let's see what you do. Let's see what you do as a result. What do you do when your child throws something or whatever that they're doing? They bite themselves, they throw something at you. Well, we have a consequence, don't we? And that consequence oftentimes sets up sort of a rigid model. And so you say to your child, don't do that anymore. And the child then will become engaged in that behavior until you say, don't do that anymore, because that's the whole package. These individuals have brains that operate in the gestalt. We call it the gestalt. It's the whole process. So just acting out is not the whole behavior. Acting out, throwing shoes, and then having you say, don't do that anymore, is the behavioral package. So again, we have to unpack that, and we have to figure out, how in the world are we going to change that? How am I going to change my response pattern? Because that may be maintaining this behavior. That may be what that child is waiting for in order to move on, to have the behavior over with. And in order to do that, we have to figure out that antecedent. We have to figure out what came before this incident. What is getting in the way and causing this behavior? It's not that this child wants to be a bad, naughty little guy. That's not it at all. Our kids are not naughty. They're not mean individuals. They are responders to an environment or to an antecedent, which is very difficult for them. And so they have maladaptive ways of responding. So again, that's what we're going to be talking about today and trying to figure out. So again, here we are with a behavior sort of schema. This is the ABCs of behavior. It's been around for many, many years. But I want you to think about the antecedent, which is what directs the behavior. Now, often we focus a lot on that behavior. That's all we're seeing. So I see that he's biting himself, and that's what I want help with, Dr. Braden. Okay, that's fine. But then can you tell me when that happens? Can you tell me what is happening before he bites his hand? Can you tell me if it's ever in an environment that he doesn't bite his hand? Can you tell me that maybe in certain situations he bites it more often than others? Okay, I'm asking you about the antecedent, the thing that directs that behavior. And then what happens after the behavior? What motivates him to either extinguish that behavior or continue that behavior? And as I said, many times the consequence motivates that child to continue to engage in that behavior. It's sort of a really interesting way of looking at it. And it's different than we're used to, and the way we've been raised oftentimes is that we see a maladaptive behavior, and our job as a parent is to get rid of that right away. We don't want him out in public doing those things. We don't want her doing things like that in front of grandma or somebody else. That's the behavior we settle on. But we haven't taken the time to figure out what's really directing that behavior, what's causing that behavior, and then what's maintaining or motivating that behavior to continue. So I'm giving you a little preview of this pre-questioning, but I want you to be aware that there are a number of lectures that I've done and webinars that I've done that are on the YouTube channel for the Fragile X Association of Australia. And many of these will be very helpful to you. The ones about understanding generally Fragile X syndrome, understanding a differential diagnosis between autism spectrum and Fragile X syndrome, understanding anxiety and behavior. That's a huge one. I think you sort of got a little sprinkling of it from me today, but I think that's a good one to revisit. And then there's a really good one with Bev Kadish, which looks at the sensory processing. We really have to account for a lot of those issues. And she's an Australian who is just excellent. And then we have the behaviors part 1 and part 2, which I think you will enjoy and learn maybe some more about, and then the learning style of these individuals through the lifetime. So that concludes my slideshow. So I think now we should start the questioning.
Oh, Marcia, thank you so much for those slides.